Breast cancer is the most commonly diagnosed cancer among women globally and the most common cause of cancer death in women. The cancer caused over 600,000 deaths globally in 2022 according to statistics from the WHO. The same year, there were 2.3 million women diagnosed with breast cancer globally. In 95% countries, breast cancer is the first or the second leading cause of female cancer deaths. For example, in the UK, one woman is diagnosed with breast cancer every 10 minutes. In the US, breast cancer accounts for about 30% of new female cancer each year. In Kenya, recent data shows that breast cancer is the most common cancer among women of all ages and has the third highest mortality. And that's why today we talk to oncologists. I'm talking about Dulcie Wanda to just try and understand what are the causes of breast cancer treatment and what can I do to ensure that I'm safe. What can we do to ensure that we are safe? Welcome as we engage Dr. Dulcie Wanda. Dr. Dulcie, how are you?
I'm very fine, thank you.
You're good? It's been long.
It's been a while.
Sure.
Nice to hear from you.
Thank you. We talk about Breast Cancer Awareness Month. What should I know?
This is a special month. October is been dedicated to a lot of breast cancer awareness, and the color to create this awareness is color pink. The reason breast cancer has been highlighted is because it's the leading breast cancer among women. Some statistics have shown 1 in 8 women will develop breast cancer in their lifetime. So if you take 8 women in random, then chances are 1 of them would get breast cancer. So if you think of your friends or think of your family members, 8 women, there are chances that 1 of them will get breast cancer. That's quite significant statistics, because 1 in 8, it means it could be me, it could be my friend, it could be my mother, it could be my relative. So it's something of significance. The numbers that we have for breast cancers are also very high. If we look at statistics for women in Kenya, breast cancer is the first cancer. It's leading in terms of incidence, in terms of even mortality. So it's important for us to note that breast cancer is here with us. It's closer than we think. It's more common than we imagine. And for us to create awareness, the purpose we want to create awareness is because we can screen for it. There's something we can do about it. For example, if you're the age of 40 and above, we can do a mammogram such that before the lump is even big, before it becomes something you can feel, then the mammogram can show us that there is a lump. It can show us the signs that it's a cancerous lesion, and then we can do a biopsy. And that really helps to catch the cancer early. The earlier we catch the cancer, the fewer the treatment options a person would need, and also the better the outcome, the better the survival rate, and the better even the overall survival, how long the patient will live after the diagnosis. So we focus on cancers we can screen because there's what we can do about it. For those who are below the age of 40, then it's important for us to do a clinical breast exam. Should we find any abnormal finding, then it's important for us to ensure that we do an ultrasound of the breast and do a biopsy if we see that.
So what causes this breast cancer?
So cancer in general is multifactorial. There's a 10 to 15% chance that it could be genetic, meaning if a relative, a significant relative of mine, a close relative, a mother, a sister has had breast cancer, then my risk are increased. There's also been an indication that if I am taking hormonal, perhaps replacement of hormones has been put as a risk factor. Others are lifestyle, being obese, lack of exercise, cigarette smoking, alcohol use have all been implicated as risk factors. But majority of the patients who develop breast cancer sometimes do not have risk factors. So you could be the first person in your family to develop breast cancer. I think one of the myths is no one in my family has breast cancer, so I will not have breast cancer. That's a myth. Not having anyone in your family with cancer does not mean you can't have cancer. The third bit is that most of the time, most people ignore a lump, ignore a small ulcer on the breast, ignore color changes, ignore skin changes, and by the time they want to give it attention, then the disease is advanced. So this is what we recommend. If you notice skin changes on your breast, you notice consistency change, one breast is heavier or larger than the other one, you notice the skin is looking like a tangerine, it has those small dots, in French called peau d'orange, if you notice that. If you notice a lump, painless lump, if you notice a small ulcer, be it painful or without pain, kindly visit your doctor. Let them examine the lump, let them examine the ulcer, let them examine the skin change, let them examine the change in shape and size. If a nipple has gone in, it's retracted, then that's something a doctor needs to look into so that we catch these cancers early. For patients who've caught cancers early, they have very good outcomes. It's easier to manage them. Some might need surgery alone, some may need surgery and some hormonal, but they have fewer treatment options compared to those who present a bit late.
I had a woman asking me, is cutting off the breast that has cancer the solution? Am I treated now if I'm found to have it and then they go cut it?
Cutting off a breast or removing the breast is called a mastectomy. The question whether it is the solution may not be a one-size-fits-all, because we do surgeries based on the stage and the intent. So there are times we do surgery with the intent of cure, we've perhaps given chemotherapy, and then now we do surgery. For patients who have a small lesion and we look at the biologics of that tumor, we're able to do surgery with curative intent, and it might be the first treatment option. For some patients, surgery is not an option. For example, if the disease is already metastatic, it has gone to other areas, removing the breast alone, doing the mastectomy, does not offer the patient cure, does not offer the patient an increase in overall survival. There are times, however, even if the disease is metastatic, we may do a mastectomy if there is a very big wound, and that would be called a palliative mastectomy, just to remove the problem that breast is causing. So just surgery alone cannot be said to be the permanent solution for breast cancer. It's dependent on the cancer you have, it's dependent on the stage you're discovered at, and even the biologics of the tumor.
What responsibility do I have to ensure that this disease has been detected early? What am I supposed to do? And if I'm found to have it, what the treatment? What is all about the treatment?
So one, we all have a role in creating awareness. In the month of October, we can create awareness, one, by wearing pink, two, by discussing about breast cancer, having healthcare professionals come and educate us at our workplace, be it at church, be it in all social events, about breast cancer. Then number 3 is going for screening. For those below the age of 40, go for a clinical breast examination where a medical personnel examines your breast. For those above 40, it's important to do a mammogram. And since the month of October we'll talk about breast cancer, it can be a good month to always do the screening yearly. The other thing that's important is let us create awareness that breast cancer happens in men also. Men have breasts, they can have breast cancer, and because they have less breast tissue, sometimes it's more aggressive because it enters the ribs and the lung easier compared to breast cancer in women. So talk about it, get screened, and share the information about breast cancer.
You've talked about men having breast cancer.
Yes, men can have breast cancer. Men have breasts. They're not the same in terms of consistency, in terms of size as women, but they can develop breast cancer.
For example, myself.
Yes.
Okay.
Yes, and the symptoms we've talked about a mass, an ulcer, change in shape, increase in size, those can happen in men too. And they need to be on the lookout. So it's good to have a good relationship with the mirror so that you can know what is your normal, so that you can be able to pick out when something abnormal happens.
When you talked about screening, there is something that is coming about from men and women. Someone decided to say, let me not get screened because if I know that I have cancer, I will die.
Well, knowledge of cancer does not necessarily kill you. I think we need to demystify cancer as a death sentence. We need to help people to understand having cancer does not mean you will die. And that will be step number 1 to helping people accept that having a diagnosis of cancer is not the end of the world. I think we need to engage survivors, those who have gone through the treatment, so that people can be able to see you can get a diagnosis of cancer, you can be treated, and you can have a life thereafter, such that cancer does not define who you are as an individual. It's just a part of your life, and once navigated, you're able to move on with the other aspects of life.
I'm done from my side. I don't know if you have any other information that you need to add, especially on this issue we are talking about, breast cancer in October.
So I guess my final comments would be, 1, breast cancer is a reality. Catching it early is vital. So let's talk about breast cancer. Let's go for screening. And if detected, let's start the treatment very early.
Okay.
Thank you very much for this opportunity to talk about breast cancer.
Karibu sana. That is Dr. Dulcie. Thank you for your time.
Thank you very much.
Karibu.
Thank you for listening. My name is Felix Asoha. Remember to subscribe to this YouTube channel.